Welcome to our series on the allied health professions, a sociological perspective. I'm Professor Susan Nancarrow, and with my co-author, Professor Alan Borthwick, OBE, we explore the social, political and economic forces that have shaped the allied health professions to make them what they are today. We believe that an understanding of the context of the professions is important to help them shape interprofessional dynamics and to empower them to take control of their own future. Thanks for joining us, and we hope you enjoy the series.
I'm Professor Mike Sachs, and I am the co-editor of a major series with Policy Press, which is entitled The Sociology of Health Professions. And I co-edit this with Professor Mike Dent, who's a trusted colleague. And it's really a great pleasure today to actually be interviewing Professor Susan Nancarrow and Professor Alan Borthwick, who've written this really excellent book called The Allied Health Professions, a Sociological Perspective. And I'm really looking forward to discussing this book, which is actually the third in the series, this Policy Press series, which has been very exciting and very well regarded. So Susan and Alan, very interestingly, in terms of this book on the allied health professions, both trained as allied health practitioners. Alan was in the UK, Susan was in Australia, and both went on, rather unusually, after several years of practice, to become top academics, which is fantastic. And this was the background to them writing the book. Alan, in fact, is a sociologist with a particular expertise in the sociology of the professions. Whereas Susan, her expertise lies in health service research, and she has a particular interest in the health workforce, but of course, particularly in the allied health professions. And so really a great team to be writing this particular book. And today I'm going to ask them a few questions to find out a bit more about the contents of what they have written, to give you a kind of taste of some of the interesting ideas which are discussed between the covers of this book. So I think if we could start off, I'd like to just ask the general question of what is the book actually about? And perhaps, Alan, you'd like to start off here.
Thanks, Mike. Yes, the book provides a basis for understanding the world in which the allied health professions operate, the forces which shape their activity, their aims, their scopes of practice, and their status, and broadly their position in the broader health division of labour. I think it provides a socio-historical backdrop which affords the professions a context, drawing on existing work, tracing the origins and emergence of the allied health professions, but also adding in new aspects and elements in a contemporary context. In addition, it provides access, I think, to the theoretical basis for understanding the professions, drawn from the sociology of the professions, and the range of work which illustrates, I think, the real utility of some of these theories, especially the neo-Weberian framework, which, Mike, your own work has really been very instrumental in all of this. And as a result, I think the book makes sense of the key factors influencing professions, the powerful audiences that need to be persuaded, and the interrelationships that forge and help shape the future. And I think it's important that, what we've done in the book is look at the way in which professions do not simply act out their own strategies to achieve the position that they desire. They're actually influenced and shaped and constrained by forces beyond the professions themselves. And I think this book examines those forces and influences and demonstrates how they work.
I mean, absolutely fascinating. I wonder, Susan, do you want to add anything to that, or
yes.
shall we move on to the next question?
As you said, Alan and I are both allied health professionals, and we've been academics for the last 20 years, Alan as a sociologist and me as a health services researcher, and we bring that perspective from the UK and Australia. I guess what was interesting, we both left the higher education sector about 2 years ago, and we were, talking about our respective careers. And I think the book was a really good time for us to draw together the expertise we've got, which is actually very complementary, about understanding the workforce and having the sociological theory to explain it. So we felt that a book was actually a really good way to unpack the allied health professions, and particularly the messy and complex dynamics that make them up. So in the book, we discuss, as Alan said, the history and sociology of the professions, but we use a number of different case studies from Australia and the UK to do this. We originally looked at trying to look at an evolutionary perspective. So we look at the well-established and well-known allied health professions like podiatry, optometry and physiotherapy. But I think what's interesting about allied health that is fairly unique is they're continuing to evolve. So we've got some really good examples of new and emerging professions in the Australian health context. For example, developmental educators, podorthists, and in the UK context, operating department practitioners, which aren't known as allied health in Australia. But we also draw on a new concept that we've called post-professionalism, which is the professions reconfiguring themselves after they've professionalised into new identities. And again, two examples of that are diabetes educators, and in Australia, rural generalists. And I think what's quite interesting about the book is the different opportunities that the Australian and UK health contexts offer for the evolution of the professions, and they have evolved in quite different ways, which we'll talk about in a bit more detail.
So was there any other reason why you wrote this particular book at this point in time?
I guess for me, as a health services researcher, I went into becoming an academic to try to drive changes in practice. So, we have a lot of evidence. Allied health professionals have really jumped on the evidence-based practice bandwagon since the 1990s and created a lot of evidence, but it's been really hard to change practice. And what I understood as a health services researcher was that it's not evidence that drives change, it's actually politics and power that drives change. And I didn't have an explanatory framework for that. And then I met Alan, who had come at this from the sociological perspective, and his PhD was exactly on driving change and the politics and power that has led to that. So it was fortuitous. First of all, we met and we had this complementary framework. I guess the other thing I'd say is we met at the late 90s, early 21st century in the UK when the European Working Time Directive was implementing fairly unprecedented changes, in fact, probably the largest changes in the NHS since the NHS was formed. And so we had that as the backdrop to writing the book. But what was, I guess, fortuitous and really unexpected was as we were finishing the book, COVID-19 struck. And we know as health services researchers and sociologists that one of the biggest impacts on the health workforce is catastrophic outbreaks of disease. And so we were right in the middle of a real life case study of exactly what the book was about. And fortunately, we had the opportunity to use COVID-19 as an explanatory framework. And I think it probably helps us in more ways than we realised set the scene for what's coming for the rest of the 21st century or until the next pandemic in terms of workforce change.
Brilliant. Well, that's a very good explication of why now. Alan, do you have anything to add again?
I think, yes. I think I could probably add that coming from an allied health professions background myself, I was struck when I was working as an allied health professional how hierarchical the nature of the health professions really were, and when I later then was introduced to the sociology of the profession and largely the work of its key authors, particularly those that address the non-medical, non-nursing professions, probably most notably Jerry Larkin and yourself, Mike. was that the theoretical insights I thought were really, really striking. They seemed to fit like a glove and provided really powerful explanations with quite a substantive body of evidence, or at least the neo-Weberian approaches certainly do. And I think that, coupled with the fact that I met Susan and I was aware of the demographic changes that were impacting on healthcare broadly. And I remember attending in fact, I was speaking at a conference in Canada, and the keynote speaker was David Foote, who was a demographer at University of Toronto. And he spoke of the significant demographic changes that were about to unfold in the next 2 or 3 decades. And of course, we're now seeing that take shape. And it's unfolding as we speak. And that's one of the reasons I think it became clear to me that the book has such a contemporary importance.
And that's a sort of fascinating background, in terms of exploring a bit further about the nature of the book. And I particularly wanted to ask you, who do you actually see as the audience for the book in the light of what you've said?
Thanks. I think there are several groups of people that we hope that this book will appeal to. Obviously, the primary market for the book will be allied health professionals themselves, allied health scholars. I think it's relevant at both undergraduate education for allied health professionals who might study the sociology of the professions. And we're hopeful it would become or will become a core text for allied health professionals. But equally, I think it's something that hopefully will be of interest to sociologists also, who might want to gain a better understanding of the varied groups across the allied health professions. And because the AHPs are seen as this large block, as it were, within the health division of Labour, and they may value a look at a bit closer at some of the details about individual professions in that block. I think as well, an educated lay audience is something that we're looking to interest in the book as well, as a health professions audience. And at the same time, earlier, Susan was making the point that emerging and new allied health professional groups are very evident these days, and we think that they might too be interested in the book, in that it might be something that they would be interested to view in terms of negotiating their own future and their own path to professionalization. And I think ultimately we would also quite like and hope that the book will be of interest not only to other health professions, but to policymakers, probably at all levels, really.
Well, that's very comprehensive, I think, Alan. And it may be that, Susan, there's not much more to say, but, the floor is open to you, of course. But it does leave me really just to push a little bit further in terms of the questions and to ask you, what are some of the key take-home messages, particularly for the allied health constituency, that you're hoping to allure into the ring, to purchase and read the book?
I'd start by saying I think probably from both of our perspectives, it was quite a luxury to have the time to sit down and look at the breadth and depth of the allied health professions. And I think when Alan and I first started discussing this book, we had to put a framework around it. And I think we both thought, hope, expected that perhaps we'd find some coherent way of describing who and what the allied health professions are. And the feedback we've had on the book already is that the allied health professions want that as well. And without a spoiler alert, I suppose, I don't think there is a way of organising the health professions that makes sense in a clinical way, but the allied health label is a way of organising disparate disciplines. And I think I'll quickly mention where we've landed on as what we've landed on as a definition of allied health, which is basically professions that have a niche area of expertise and work with a particular population group. And that differentiates them from the large professions of medicine and nursing, which have a large generalist base, and within that, quite a lot of subspecialisation and differentiation. The allied health professions largely don't have that, and that is quite a unique point. And it means that they actually need to come together as a whole to be able to meet their community needs. And I think that was quite an important frame for the book. We're moving towards multidisciplinary practitioners, so they sometimes take on a broader repertoire of skills, but in fact, you need a multidisciplinary team generally to meet the requirements of the population. And the way you configure that team will depend on the needs of the population and the context in which they work, which is where I think the case studies have been important. For instance, the rural generalist case study in Australia is a context that basically doesn't exist in the UK. It's a completely different need and group of professions and different context, but it's driven a new way of those professions working together. So the first thing I'd say is we've really put a microscope on who and what the allied health professions are and how they're organised, and I think we provide tools to let them negotiate that in the context in which they work, but we don't have a single definition. And I think what was also interesting to us was understanding the variety of inclusions of allied health across different jurisdictions. For instance, one of the earliest reports on allied health from the United States in about 1986 reckons there were over 200 different groups that could be identified as allied health. Now, within our book, we probably focus on no more than 30, but there are other groups that are coming in. I guess one other point that I think is interesting and probably will be contentious in the book, my work, my health services research work with the professions, and I think we know the sociology and the neo-Weberian take is most professions or emerging professions think that the elixir of professionalism is state regulation. And I think one of the key findings for me in this book is actually the self-regulation framework is as good, possibly better for the allied health professions. I'll let people read the book to come to their own conclusions, but yeah. I actually think we over-regulate allied health in most contexts. And I think for me, the third really important finding, which Alan and I knew but has really come out of the book, is the extent to which the allied health professions have been very good at commodifying their tasks and then reallocating them to other professions, which is kind of at odds with what we know about the sociology of the professions, and particularly the neo-Weberian frame, which is that professions are trying to protect and contest their boundaries and stop others encroaching. And there is some evidence of that in allied health, but I think they're actually quite consensual in the way they reallocate tasks to other disciplines, which will have an interesting impact on the future of those professions and probably prepares them quite well for the future. Alan, I know you've got some other points, so I might hand over to you there.
Sure, thanks. Thank you. But my comments are very similar in a sense to Susan's, as you'd expect. It struck me that that one of the things that would be a take-home message is that the allied health professions perhaps shouldn't cling to traditional rules and boundaries, which may not really be sustainable into the future, as the workforce solutions to the demographic problems, etc., are always around increasing flexibility and adaptability and responsiveness. And as Susan pointed out, the allied health professions have been fairly good at that. And so jurisdictional disputes and that sort of thing may no longer be an appropriate type of response to these shifting demands on an increasingly stretched workforce. Equally, they won't disappear by evaporation. It takes work. But I think the allied health professions must balance that need to retain identity and jurisdiction with a new need to agree to multidisciplinary working, to blurring at the edges, or in fact, even more radical changes to the role and function in order to accommodate these new demands on health services within a reconfigured workforce.
Well, I think the readers are in for a treat, because I think the points you've raised are fascinating for me, as a neo-Bavarian. I particularly like the point about the fact that voluntary self-regulation has really, come to the fore as well. Maybe it's not the statutory regulation that we should be seeking. And similarly, I think, Alan, you provided some stimulating thoughts about how far it's all about the politics of jurisdiction. So in a way, it may be that the allied health professions are pointing the way ahead, that they're at the head of the field rather than behind the medical profession, behind the curve. So it all sounds really interesting. But how have you actually structured the book to get your messages across, and these key messages that you've given?
When we first started discussing how we were going to make sense of this huge heterogeneous mess, we started from an evolutionary perspective. And I think one of the unique points that Alan's and my work has offered to the sociology of the allied health professions has been really framing them in the modern context, but drawing back their history to the post-industrial era and before that. So we've used, I guess, chronology and evolution in a way to structure it. So we've looked at what we've called emerging professions, which we've already discussed, developmental educators and podorthists and other examples of those. We've looked at the well-established professions, and then we've looked at post-professionalism. So what's happening as professions move beyond their professional framework. And we also have a chapter dedicated to what we've called the support workforce. So it's a delegated workforce, allied health assistants, occupational therapy assistants, and so forth. But to set the context for the book, we have put, the opening chapter is on the sociology of the professions, and particularly the theoretical constructs that are really important to help the reader understand the book. And Alan wrote that chapter, and I think he's done a really good job of really framing some quite complex concepts in a way that do set the frame for the book. And the second chapter, again, necessarily sets the international context. So we talk about the difference in the Australian and the UK health contexts, which was really important, again, for framing the book and has been one of the most important findings, I think. And the regulatory frameworks for the professions. But we got to the end of the book, and the elephant in the room for both of us was diversity, and particularly gender. We both knew that allied health was a highly gendered, highly female, highly feminine workforce, and that there wasn't much on it. And to have to go into the gender issues for potentially 30 or more professions was going to be a nightmare. But by the end of the book, we spoke and said, we can't get away from this any longer. So we threw a section into the conclusion saying, look, basically what I've just said. And the reviewers didn't let us get away with it. In fact, it might have even been you, Mike. And the conclusion was, yes.
Hands up. In part.
We need more on this. And so we went back to it. And actually we realised, diversity is not a binary issue. It's not just about gender. It's about a whole lot of other issues. So I think with 2 weeks to go before submitting the final manuscript, we ended up having to throw out 10,000 words and insert a new chapter on diversity, which I now think is probably one of the most important contributions that the book makes. I don't know whether you want to add any more to that, Alan.
Well, I was going to say, actually, that it's a great chapter. So fantastic to have done that in a couple of weeks to respond to the reviewers, anonymous as they may be. Alan.
Yeah, thanks. No, I mean, I quite agree. I think Susan captures it neatly. For me, I think in many ways, I think that in the book we sort of looked at the way in which the allied health professions originated in different ways, yet ended up classed together as this collective. And I think we traced that trajectory and showing how these groups were then drawn together and how subsequent events have produced new groups and new responses to the challenges which they face today and which will reshape allied health in future in different dynamic ways.
Yeah, it's such a great area, isn't it, for research? And the corollary of this is, was there anything else that was sort of surprising, in terms of your analysis? Because I suppose with the gender issue. We always knew that it was going to be important, but it was a question about, you know, looking at some of the difficulties of researching, as you say, 30 different professions, Susan, and more, you know, that you've highlighted, and coming up with something that was cogent, which indeed you have done. But is there anything else that was surprising? Maybe I can direct that in part at Alan.
Yeah, I think actually for me, it was particularly the issue of gender and diversity that was the surprise, in that we knew that there was this problem. We could write an entire book about the topic, but didn't want, obviously, to do that because we had other things to say about the health professions. But equally, we didn't want it to be a token gesture. Effectively, we knew it had to be substantive in some way, and it was a surprise, I think, to me that it featured quite so prominently in the end in the book, and how important and critical to the sort of socio-historical development of the professions and the current context that these two topics sort of.
I mean, were there other aspects of diversity that were important in the book? I mean, thinking about Aborigine culture and other things, and their engagement, and obviously issues to do with you know, diverse cultures in the UK.
Yeah,
Was that
I'll
something
pass
that
Susan for that. Yeah.
I think one of the things that was interesting about diversity was, so first of all, there wasn't a lot of literature. The literature that was there was largely gendered, and that was important because of the gendered nature of the professions. So one surprising finding was a lot of the well-established professions actually started off as quite masculine professions, and then as they professionalised in the 20th century, they became more feminised. So gender dominated the discourse, and I think part of the reason for that, and again, this shouldn't have surprised us, but it did, the allied health professions have largely emerged out of a British colonial white middle class model. And that discourse was dominated by white paternalism until, frankly, late last century. And so the issues of other types of diversity, like ethnicity in particular, they weren't even on the table until later last century. In fact, really most of the literature's come up in the 1990s. And I would say a lot of that is still fairly colonial literature. We still look at diversity from a colonialist sort of perspective. The one caveat I'd say to that is, of course, every country has its own perspective on diversity. So issues around ethnicity, cultural diversity in the United States are completely different to what they are in the United Kingdom, and they're quite different to what they are in Australia. So I won't go into the different discourses, but, you know, again, there's not a way of homogenising that. But I think it's a young field, and I think we need different language to look at it. If I could just say, one of the other interesting findings for me, in 1997, I went on a primary healthcare mission to a very poor part of northern India, where I was the only allied health professional, and there were doctors and nurses. And of course, there was no allied health there. I was a podiatrist. People didn't even wear shoes. And one of the things I wanted to understand in this book is why is allied health a middle-class Western construct? And we were able to touch on that in two ways. One, by looking at the way health care has developed in China after the Second World War. China was very impoverished and had very, very high rates of infant mortality and a low life expectancy. And their solution then, Chairman Mao said, I'm not going to introduce the Western medical model because it's too individual, takes too long to train people, and it won't meet the needs of our population, which were basically population health issues. And so they went for a much more population health framework. And it's only now in the last 20 years since, well, actually, I guess since the 70s, that they've started to get higher income and a more Western model of medicine that they've started to introduce the more individualised approach to healthcare. But similarly, we were able to look at examples of healthcare in Africa where they've got traditional health workers, such as bone setters, and they're a really important part of their community, particularly in poorer communities, but they don't have the standards and quality that we would expect in a Western medical model. And so we found a really nice case study of where a town has tried to integrate the traditional bone setters into standard orthopaedic treatment. And so, we've been able to put some quite interesting lenses on different angles.
Because it's interesting that your comments, have taken us into the global sphere, which is really important. And yet the book itself concentrates primarily on the UK and Australia. But it's great that you spin out, more widely, into the global context. That's good. But in terms of the focal points of the UK and Australia, I just wondered really, why did you choose these countries, for comparison as a kind of spine for the book, and what do you think the implications are of choosing these two cases?
I mean, the obvious starting point was I'm Australian and Alan is from the UK, so we had those understandings of context. But in fact, as we moved through the book, using those contexts, it was really quite a valuable perspective, which I think does give us some learning for other contexts as well. So Australia is obviously a colony of Britain, and most of the governance, the health regulatory system has come from the British model. Our allied health professions originated in the British model, and there's a lot of shared background. And in fact, it's interesting, Australia, and we still tend to do it, took the best of what was happening in terms of health governance and introduced it a bit earlier than they did in the UK. I think Tasmania was the first colony to regulate the medical profession in 1838. But they then diverged after Federation of Australia in the early 20th century. And I think what's a really important component for the book is to understand the divergence of those health systems and how it's shaped the allied health in the two different countries. So as the NHS went down a largely monopolistic model, and most allied health is still largely employed by the NHS, and the NHS is the organising frame for the allied health professions. In contrast, the Australian framework is highly pluralistic. We've got a public, private, we've got state, federal, where allied health is largely organised in health and social care models in the UK. In Australia, we've got healthcare, disability, aged care, correction services, education. So allied health are dispersed in a completely different way, which actually leads to very different workforces. But I think for me, the key learning was the way that the allied health professions have been able to evolve in each jurisdiction. And I think this is actually really important for the health professions generally. What we've seen is with the far more pluralistic model in Australia, allied health and the self-regulation framework, which exists in a different way to Australia to what it does in the UK, it's let new health professions evolve in response to market needs. So in Australia, we have diabetes educators. In the last 50 years, we've developed exercise physiologists. We've got podorthists who are orthopaedic footwear manufacturers. We have a case study on a relatively new profession called developmental educators, which have emerged in the disability space. And they've actually been able to use allied health as an organising framework to advance their own professional and professionalisation arguments. Now, in contrast, the allied health professions in the UK have remained relatively stable since the 1960s, since the COPE report. There was a little bit of a reshuffle in the early 21st century with the introduction of the Healthcare Professions Council. But we don't see the emergence of the new professions in the UK the same way we do in Australia. And we're not making a value judgment about that, but it's been very, very illuminating to understand how those different healthcare contexts shape the professionalisation of the workforce.
Alan, did you have any insights from, if you like, the other side of the globe in terms of UK reflections on learning more about the Australian system?
Thanks. Yes, I think that international comparisons clearly have a huge value, but when they're feasible, and I think sometimes it is a bit difficult to compare like with like when addressing different national, political, and cultural contexts. Obviously, that has been done, and I think Keith MacDonald's work shows that, and Mike, your own work has been a great example of how that can be done across different nation states. But I think, from my perspective, that there are some similarities between the UK and Australia that Susan alluded to earlier. The sort of legal, political, and to some extent cultural contexts are probably quite meaningful between the UK and Australia in terms of allied health. And indeed, some of the key instances, for me, it's remarkable how similar they can be. So, for example, the battles over access to rights to prescribe medicines, for example, both for allied health professionals in Australia and the UK, is a fine illustration of exactly that point. They're very, very similar. So whereas there are all those differences that Susan speaks of, but there are also key similarities that allow comparisons to be made that are quite meaningful.
Well, I mean, both of your contributions on that particular question suggest that there isn't necessarily a right way, and that there are different models that are employed, which are, specific to particular socio-political contexts. But having said that, I mean, there may be learning in both directions, actually, in terms of models of best practice as well. So that's something to keep an eye on in the book as well, too. But I was...
another comment on that, Mike. I'm sorry to
Yes, please do.
When I first moved to the UK in 2001, I had been part of some attempts in Australia to get supplementary prescribing for allied health professions. In fact, they'd been trying that for at least a decade. When I moved to the UK, because of these rapid changes in the workforce due to the European Working Time Directive, there was a huge downward pressure on the workforce. And so allied health professions were being encouraged to prescribe and extend their roles and boundaries, which would have been music to the ears of the Australian allied health professions. But what I noticed was that so the AHPs in the UK were in a very authorising environment, but were very slow to take up prescribing. And yet the allied health professionals in Australia were fighting to have this right, and really, quite envious of where the UK was. It struck me as quite an interesting difference, and that was largely mediated by the different healthcare contexts.
Yeah, I mean, you've underlined really your book on the allied health professions actually is very centrally involved in looking at the way in which the workforce changes and evolves over time. And I think that nothing could have prepared us for one of the biggest impacts, seismic impacts in terms of socio-political change than that wrought by COVID-19. And I just wondered whether there were any messages in your book in relation to COVID-19 and its implications for the allied health workforce.
Yeah, I think that COVID-19 has, in a strange way, has provided allied health professions with opportunities to undertake new roles. And I think we've seen that take shape over the last few months, allowing physicians to focus on managing the pandemic. And we know of allied health professionals, occupational therapists, physiotherapists, podiatrists who've been involved in managing COVID patients, from proning patients in intensive care to covering the prescribing of medicines on orthopedic wards, for example, to release the doctors who would normally do that task to manage and be redeployed elsewhere to help in the pandemic. So expanded roles which are actually beyond the normal scope of what is generally recognized as allied health professional practice may become something of a new norm as a consequence of this. And we can see that as well with the development recently of first contact practitioner roles, for example, or specialist practitioner roles. There have been specialist practitioner roles in rheumatology, for example, and podiatrists or physiotherapists or occupational therapists can apply for those posts. And the roles that are involved with those posts tend to sit outside the normal scope of practice for the profession in which they've actually been trained. So obviously there are some difficulties around that legalistically with access to medicines and that sort of thing. But I think that maybe one of the key messages here is that allied health professions may now have a normalized, a new norm, as it were, of an expanded scope outside what had traditionally been allied health practice.
Yes, Susan, have you found a similar kind of phenomena in Australia? You know, the kind of unfreezing and perhaps not quite yet resetting, but moving towards some rejigging of the interplay of the allied health professions with other, you know, within the healthcare division of labour?
Yes, and I think we're seeing a lot of similar types of things to what Alan said, although COVID's been managed quite differently here, but the health workforce was definitely put on the ready to respond to those changes. There are, I think, three important contextual issues here that are worth exploring. The first is allied health professions have really grown over the last century in response to the increase in chronic illness. And so for the first time in a century, we've seen a shift towards infectious disease. And so allied health professions have had to rapidly reframe themselves to meet that response. And I just hark back to some of your early work, Alan, on how our podiatry got supplementary prescribing and the work of anaesthetics. So the last time we saw this kind of change was during workforce shortages during the First and Second World War, when allied health professionals were brought in, and podiatry in particular, started doing minor surgery using local anaesthetics. And that became a normal part of the repertoire for some of those professions, which they then had to fight to hold on to. But I think, you know, we can draw on that learning now and say if allied health professions can be involved in acute care, infectious disease management, stepping outside their boundaries, then that can become normative, as you've explained. I think there are two other really big changes, and one is specific to Australia, but the first one's global, and that's in the last few weeks, but it's been happening for the last couple of years. I think we've seen a huge shift in gender dynamics, and I believe with the confluence of a whole lot of things that have happened globally, we're going to see a new wave of feminism. And I think we're already seeing the movement. I'm seeing the shift in language for a highly feminized workforce that will have implications. So certainly in Australia, allied health professions aren't paid all that well, and you know there's a general issue around women's work not being valued. I don't know how it will play out, but I do think the gender issue will be very important for shaping the way that the professions move forward. The other issue that is current in Australia, but it's not in the UK, is COVID-19 had a huge impact on our higher education institutions. We were highly dependent on international students, but many of the universities are closed down for a year, only took students, distant students. We haven't allowed international students back into the sector. And as a result, we've lost nearly 10% of the higher education workforce. And I think some of the messages that we point to in the book around the codification of professional work is something that we're starting to see in the universities. That codification and standardisation, I actually think, means that we will see other ways of delivering that work. Universities don't need to deliver standardised course content. We've seen that you can deliver that online, anywhere, anytime. There are already moves to standardise the nursing curriculum. Will we see that in allied health? I suspect we will. I think I think we'll see a rapid change in the way that higher education is delivered to the professions, and particularly the healthcare professions. And again, we don't know what that looks like, but we're on a technological precipice now that will let us realise that extremely quickly. And I think the sort of shifting tectonic plates in the socio-political landscape will drive that. The other issue I think that will drive changes that we haven't touched on is the huge global debt, and the fact that, you know, with an ageing workforce, we're throwing more and more resource at healthcare. There'll be pressures to reduce those costs. So, you know, all of those things will interrelate and interact to have a huge impact on the workforce. But we could probably guess how that might play out. But you know, it will be interesting to see.
Yeah, there are parallels here, aren't there, really, with the Second World War, you know, and certainly I can think of it in the UK context, you know, where women went into some jobs that were traditionally seen as reserved for men. And then when the war ended, the tide sort of came back again, you know, and they were left high and dry, and the men took their jobs back. I'm being, you know, very crude, you know, in terms of the overview. But it will be fascinating to see, with all these different kinds of forces, where the allied health professions will end up, because you can see great hope, you know, particularly in the B2 movement and other things for women, thinking about the allied health professions. You can see great opportunities in terms of taking over roles. But as you say, Susan, I think a point very well made, the issue of global debt is going to hit many aspects of our society. And it's quite unpredictable to see what might happen as a result of that. So I think it's really read your book, watch this space, and let's hold our breath for the allied health professions, you know, because, you know, they're doing a very important job, which is either well or not well recognized. And this is the time when we need to reappraise the role of the allied health professions in society as a whole. And so what I'd like to do is to say that there are no two authors other than yourselves who could have written so effectively about this particular subject. And I read your book with great interest, and in fact was cross-referring it to tonight, you know, on another project I was working on, going through the pages and using the index and so on, which was superbly set up, by the way. And but really, to come to a conclusion, I'd really like to thank you both very, very much for spending the time to talk to me about your book, The Allied Health Professions, A Sociological Perspective. And just to put in a plug, which you may be too embarrassed to make yourself, the book is available for purchase from Policy Press, or it can be purchased online as a hard copy or ebook from most booksellers, including, of course, Amazon. So, you know, it's there for the taking. And if you can't afford it, you can buy it and order it for your library. So, you know, if you're in the university sector or elsewhere. So, I am Mike Sachs. It has been a great pleasure talking with you both. Thank you very much.
Thank you very much. Thanks, Alan, as well.
Thank you.
We hope you enjoyed this episode of the Allied Health Professions, A Sociological Perspective. If you'd like more information on any of the topics you've heard, all of the information in this podcast series is contained in our book of the same title, available from Policy Press. We'd love to get your feedback and reviews on any of the topics in this book. Allied health is an enormous topic to cover, and we couldn't possibly do it justice in a single book. We invite you to engage with us through our website, ahpworkforce.com, or Twitter @AHPWorkforce. We look forward to hearing from you.